Thank you to my co-authors and the OTA for allowing us to present our results today. The title of this study is Calcaneal Avulsion Fractures in 35 consecutive patients over 17 years at a level 1 trauma center, an injury pattern fraught with soft tissue and bony complications. We have no disclosures pertinent to this topic. Calcaneal avulsion fractures are rare and represent approximately 1 to 2% of all calcaneus fractures. Commonly seen in diabetics and osteoporotics, this injury pattern was first described in 1852, and since that time the data surrounding this injury has been comprised largely of case reports like the one shown here, with 15 case reports yielding a combined 35 patients treated operatively. There's minimal data that can be used to guide treatment. Our clinical experience suggested this injury pattern carried a high complication rate, with soft tissue compromise and fixation failure occurring commonly. In addition, individual surgeons at our institution favored a variety of fixation constructs, including differing size and numbers of screws, and differing use of the washers and soft tissue augmentation, suggesting a gold standard did not exist or was not yet known. With this in mind, we sought to review our experience with calcaneal avulsion fractures. Our primary objective was to review the radiographic and clinical outcomes following this injury. Our secondary objective was to evaluate for factors leading to an increased chance of treatment failure. This included surgeon factors such as implant choice and the use of soft tissue augmentation, and patient factors such as age, mechanism, and diabetes. We reviewed the imaging of approximately 1,100 calcaneus fractures and identified 35 calcaneal avulsion fractures. Our cohort of 35 patients had an average age of approximately 50, ranging from 17 to 89, a distribution which appeared bimodal. We had 26% smokers, 17% diabetics, and 29 of 35 were treated operatively, 27 of which had 3-month follow-up. We documented the incidence of soft tissue compromise, which included open fractures, posterior skin breakdown, and those with threatened skin necessitating urgent treatment. We collected demographic data on all postoperative complications, including wound complications, reoperation, and fixation failure. We collected instances of both loss of fixation with subsequent displacement of a previously captured bony fragment and fracture displacement, characterized by loss of reduction and displacement of fracture from the immediate post-op radiographs without loss of fixation. Our results demonstrated a high incidence of soft tissue compromise at the time of presentation in 43% of our patients. This in comparison to a rate of 21% seen in tongue-type calcaneus fractures. Wound complications were also common, occurring in 30%, 6 of which were wound dehiscences treated with local wound care, and 2 required plastics treatment. Loss of fixation was common, occurring in 30% of patients, and fracture displacement was seen in 15%. 37% of patients required reoperation, most commonly for removal of hardware, although 4 required revision. We analyzed the influence of construct on failure rate, and in 24 patients treated with screws, we found no difference when looking at screw size, comparing a cohort treated with screws 4.5 millimeters or greater against one measuring less than 4.5 millimeters. Next, we compared patients treated with 3 or more screws to 2 or less, and again found no difference in failure rate. When comparing a cohort with washers to those without, we saw no significant difference, although there was an increased trend for failure in the cohort treated with washers. The addition of a soft tissue procedure, for example, supplementation with suture anchors or a strayer, did not affect failure rate. When looking at patient factors, we found that patients over 60 were no more likely to experience failure than the cohort under 60. Mechanism also showed no difference, with both high and low energy groups hovering around a 45% rate of failure. Lastly, the presence of diabetes did not have a significant effect on failure rate. Although admittedly underpowered, this analysis did not yield any factors which predicted failure of fixation in these patients. Other notable findings from the study included no instances of amputation postoperatively. Additionally, we found of the 15 who presented with skin compromise, only 2 required soft tissue reconstruction. Limitations of this study include its retrospective nature and sample size, yielding a underpowered analysis. We're currently in the process of collecting multiple centers to enhance this analysis. In conclusion, avulsion fractures of the calcaneus had an overall complication rate of 60%. Soft tissue compromise was common at a rate of 43% and should be addressed early to optimize outcome in an area at high risk of wound complication. While a rare injury, calcaneal avulsion fracture should be identified early and approached thoughtfully, acknowledging risks are high. Thank you.
Thank you.